A driver diagram is a structured way of visually displaying how you'll achieve an aim. It clearly helps to identify what you want to achieve, the why, what will help you achieve your aim, the what, and how you will do it, the how. It is developed together as a team, and the outcome summarises a team's change ideas and associated actions in a visual and easy to understand format. Driver diagrams are structured charts of 3 or more levels. They translate a high-level aim into a logical set of high-level factors called primary and secondary drivers that you need to influence in order to achieve your aim. They also show the change ideas that need to happen to achieve these high-level factors. This logical structure helps you to create an achievable action plan following a thorough examination of all the factors that influence the aim. Driver diagrams create a visual representation of a project, moving the conversation from concept to action and allowing you to communicate a project easily, which promotes sharing and collaboration. They also deliver clarity on what should happen, providing a blueprint for what should be done. Driver diagrams can help reduce variation in an area. For example, could a patient describe the same need to 2 different clinicians and get a different outcome as a result? Driver diagrams help teams to achieve a consistent way of working across a process or system, building consensus across a team. Driver diagrams can be used in a range of different ways. The main purpose is to define what good looks like. They can be used during the initial planning stages of a new process or service so that everybody understands the common aim. Or they can be used if you want to establish some norm or consistency on how your current processes work. This is not about making everyone work exactly the same all of the time. This is about greater consistency where it is helpful and thinking about what variation is reasonable and what is unacceptable. Or you can use driver diagrams to look at a complicated area and you don't know where to start. By focusing on what your aim is, you're able to remove the negativity and frustration that may arise from a problematic area, creating a shared common aim that you want to work towards. Driver diagrams are also really useful tools for collaborative projects where you may be working with others to achieve a shared aim, for example with neighbouring practices across your locality. The first step is to choose the area or process you want to focus on and develop a shared aim for. Next, you need to identify the team and all the people that are involved in your focus area. It's helpful to start by spending a few minutes discussing what works well and not so well at the moment and ensure that everyone understands the rationale behind the area chosen. Next, you can start to populate your driver diagram starting from left to right. There are 3 simple stages to follow to create your driver diagram. 1. Agree your aim statement. 2. Identify your drivers. A driver is something the team will need to do to achieve their aim. And 3. Identify your change ideas and create your actions. The first stage is to agree your aim statement. This should clearly define what you want to achieve and give a clear indication of what good looks like and will be the focal point for developing your driver diagram. The process of creating an aim statement alone can also be very beneficial in driving change. It can support the team to think through and articulate their common reason for coming together to work on their chosen area. It focuses on commonalities of what the team want to achieve together, moving beyond any challenging and complex areas or conflicting priorities. It engages and empowers teams to work together to develop new processes and services together too. Make sure your aim statement defines the characteristics of what good looks like. A helpful technique to achieve this is by using the SMART acronym approach. When you're thinking about your aim statement, make sure it is specific. What is the specific issue you want to address or improve? What outcome are you seeking? Who are we trying to support with the aim? And who is the target population? Next, ensure your aim is measurable. How will you know you've made an improvement? What impact will we make? And consider how this could be measured. Including a measurable outcome or target is useful to include in the aim statement. Next, is your aim achievable? Is it doable? Are there any constraints you're working to? And do we have the necessary resources and skills to achieve it? Next, is it relevant? Is it important that we focus on this? Is it meaningful for our team and the people that we serve? Finally, consider timescales for your aim. When do we want to achieve our aim? Is now the right time to do this work? Working through each of these SMART prompts will help you build a shared aim together. The next step is to identify your primary drivers, the what. These underpinning factors are referred to as drivers as they drive the achievement of your aim. To help you identify these, ask, to achieve our aim, the things we need to do or improve are using action language like improve or decrease for your drivers, as this can really empower and motivate the team as well as being specific as to what you want to achieve. If you're looking at an existing area or process, ensure you include the things that you're already doing. Your driver diagram is your blueprint of the ideal way of working, so all drivers should address these regardless of whether they are already being achieved and working well. In addition, you may feel that some drivers might be outside of your team's control. Again, it is important that the ideal way of working is captured regardless of whether the drivers are internal or external to you. The inclusion of these types of drivers provides a visual prompt, bringing what needs to happen to the forefront, encourages teams to consider areas previously thought of as too hard to tackle. The process of breaking down a factor and achieving your aim can continue to lower levels to create secondary drivers. Secondary drivers are the main factors which influence the primary drivers. The final step is to create your change ideas and actions. This moves the conversation from your concept of what needs to happen, the drivers, into the how through identifying the change ideas and actions. Work your way through each driver and consider what change ideas and actions you can undertake that will result in the aim you're seeking. This stage can lead to a range of ideas. Remember that you may already be doing some of the things you have identified as key to achieving your aim, so not all drivers may need an action. Even though a large number of ideas or actions can be generated, try not to be put off by these. Many of these can be very quick and easy. The important thing is to prioritise what you want to do. You can also use your driver diagram to develop your action plan. Use an additional column to link your actions to your change ideas. This means that everything can remain in one single document. Here is a scenario of how a driver diagram may be applied to prescribing. The first step would be to create the aim statement. In this example, the aim statement, an efficient and safe prescribing process. The next stage was to identify the primary drivers. One of those is to have a clear setup of repeat prescriptions with patients. Following that, a further driver, a secondary driver, could be that patients understand what the drug is for and how it is monitored and reviewed. Following the process on from primary to secondary driver, a change idea for this may be to develop patient information for those patients on drugs which cause high dependency. Here is a scenario of how a driver diagram may be applied to access so that it can bring a shared approach to appointments. The aim was to reduce variation in appointment management. The reception team identified their primary drivers to help them clearly articulate what they needed to do to achieve their aim. For example, we all say the same thing. Staff know who to book appointments with, and patients are aware of the booking process. Examples of change ideas were to develop a script for reception staff, develop a visual nursing appointment list, and provide further details on the website for patients. Here is another scenario of how a driver diagram may be applied in general practice. The aim for this particular driver diagram is for a shared understanding of a simplified, efficient and safe task process. Consideration would then be given to what would drive a team to achieve this. The primary drivers therefore may include that all staff understand the process and their responsibilities. We have appropriate task categories. We have clear timescales on tasks. We have appropriate staff and groups on the system, and tasks are written clearly and concisely. For the primary driver, we have clear timescales on tasks. The team agreed 2 specific change ideas. 1, to utilise the time function on each task, which was not previously used, indicating when a task should be completed by. 2, agree a definition for an urgent task, as there were several variations in opinion on what an urgent task could mean, whether it would be 2 hours, a session or 24 hours.